My name is Marc Lobbes. I'm a dedicated breast radiologist at the Zuiderland Medical Center, which has two locations in Sittard-Geleen and Heerlen in the southern parts of the Netherlands. I've been practicing breast imaging as a radiologist since 2011, and my main areas of interest are contrast enhanced mammography, which I've been implementing in everyday clinical practice since 2012. And my main areas of expertise and research are trying to implement contrast enhanced mammography as a really certified imaging tool in everyday clinical practice. So contrast is important in any kind of oncologic imaging because when tumors are small, they want to grow, and for this growth they need nutrients to keep up with their growth demand. Now when the tumors start to grow and they lack nutrients, they become hypoxic, shortage of oxygen and nutrients, and this is the reason why they start excreting vascular endothelial growth factors. These are small molecules and proteins which allow small vessels to grow towards the tumor itself, enabling it to form its own blood supply and keep up with the nutrient demand that they have when they want to grow. And now there's something strange about these newly formed vessels because they are very disorganized, and that's the reason why they are very leaky to any kind of contrast agents, especially iodinated contrast. So there's a certain window of time in which there is contrast within the tumor, and we can sort of abuse that with the specific time or type of imaging modality to capture that moment in which tumors are enhancing, so they contain contrast, and that allows us to distinguish them better from the surrounding breast tissue. So contrast enhanced mammography is a new type of mammographic examination. It has quite some similarities to conventional mammography. So the patient still needs to be positioned between two compression paddles. But before we do the image acquisition, we administer contrast through the bloodstream in a similar fashion that we're used to for using, for example, in CT examinations. So we're quite familiar with those protocols. Now after 2 minutes the patient is placed between the compression paddles, and the machine itself does not take one image, but in quick succession it takes two separate images with a different energy spectrum, but that's a little bit of a technical story behind that. But it allows us as a radiologist to not only look at the normal mammogram, but it also provides us with what they call a recombined image, and that's an image in which areas of contrast uptake can be visualized. Well, these areas of contrast uptake are suspicious for breast cancer, but not really a proof of breast cancer, because there are still many other benign structures that can also cause enhancement. But at least it should be triggered to the radiologist that there's something of relevance going on right there, and it should be further investigated, for example, with targeted ultrasound. Well, during the years we have more extended the indications for which we use contrast enhanced mammography. At first, when I started to implement contrast enhanced mammography, I chose to reserve it for the recalls from breast cancer screening because I thought there was already a higher chance of detecting breast cancer in those women, and that would sort of justify for me the use of iodinated contrast agents and also the slight increase in radiation exposure for those women. Now with time we grew more and more confident, and more scientific literature was becoming available from different groups as well, and that's the reason why we right now have not only the recall evaluation from women that are referred from screening, but also preoperative evaluation of breast cancer extent. Where we used to do breast MRI, we now do a lot of contrast enhanced mammography for that indication. But you can also think about response monitoring in women treated with neoadjuvant chemotherapy. That's also a big terrain of breast MRI before, but more and more evidence is occurring that you can use contrast enhanced mammography for that indication as well. I absolutely believe that contrast enhanced mammography can be an alternative to breast MRI. There has been a heated discussion for many years whether contrast enhanced mammography could be a replacement for breast MRI, but that's not the way how I see it. I think both modalities can exist in parallel, very good. Both have their strengths and their weaknesses, and we should look at the patient as an individual case where you can use the best modality in that particular case itself. Now, for example, contrast enhanced mammography is very easy to implement. You can organize it as a one-stop shop in your everyday clinical practice, so you don't need to make separate appointments. Of course, there's a small increase in radiation dose, but that's very limited. And some other people even say in studies that they give the preference to contrast enhanced mammography when they underwent both modalities. It's not a matter of whether contrast enhanced mammography can actually replace breast MRI. There are still some very good indications for breast MRI itself where contrast enhanced mammography has the disadvantage. And you need to think about breast implant evaluation. When you have breast implants, you get artifacts on contrast enhanced mammography, and of course you have the masking effect of the implant covering the mammographic view. So that's some reason why I would always prefer breast MRI in these cases. You can have lesions close to the chest wall, you can have lesions in the medial part of the breast, which we know that are very challenging to capture within the mammographic field of view. So those are cases which I would always prefer breast MRI. But in many, and maybe the majority of the cases where we first would do a breast MRI, we can easily switch to contrast enhanced mammography. Right now, based on the current literature, there's hardly any difference in terms of diagnostic accuracy, but we should be very careful because the number of publications that are out there is still very limited. So as far as I'm concerned, it's looking good on the part of contrast enhanced mammography, but we still need many more studies to at least confirm the results and the trend that we observed in previous studies. Well, I think it's important that you have pioneers such as myself who truly believe in the technique and have embraced it to further push it and to set the boundaries where the proper indications lie, do appropriate studies in terms of cost efficiency, and really try to figure out where the strengths and weaknesses of the techniques lie. Also, I think it's important right now that since we already have a broad acceptance within the breast imaging community, we should also extend to other specialists concerning breast cancer care, like surgeons or oncologists or radiotherapists, to have them informed that the technique is there, how they can use it, how they can read it themselves. So I think we should extend not only from the imaging community, but also to other specialists involved in breast cancer care. Well, I think there are some important improvements that we can figure out, not only from a technical point of view, seeing whether we can reduce the radiation dose that's applied. Maybe we can figure out whether we can use a little bit less contrast volume, which is also very beneficial to patients. But I think the next level would really be advanced applications like artificial intelligence. There are many studies now being published on the use of radiomics, deep learning, and other techniques in artificial intelligence to help support the radiologist who's reviewing the cases. And of course, a very important disadvantage that was mentioned many years, it was the lack of contrast enhanced biopsy. That was always a little bit of a disadvantage for contrast enhanced mammography. We need to make a workaround with breast MRI guided biopsies, which in practice worked out fine, but you created the diagnostic delay. But now I think the most important vendors are all introducing contrast-enhanced biopsy applications, and that's, I think, the next important hurdle that was taken for contrast-enhanced mammography. Well, I think the most important take-home message is that contrast-enhanced mammography is here to stay. It's not a research tool anymore, but it's a really dedicated breast imaging technique that has now found its way to clinical practice. And it's our job as a radiologist to really figure out where the strengths and weaknesses lie of this technique. But I'm fully confident that it's a technique that's here to stay.